All right, so what is a joint? It is an articulation, meaning two parts moving against each other. So, for instance, your finger joint, there's a phalange bone, another phalange bone, and there's a joint between. So the joint allows a smooth, friction-free movement of a particular bone so that we can exist in space and do things. So the joint form dictates function, and you'll see this a lot in the human body and in nature. Form follows function, okay? So how something is shaped and its material properties often dictate what that thing does. So for instance, think of a wheel. It's round, right? And it has a smooth surface. So generally, that is going to dictate that it rolls, right? You're not going to bounce a wheel as much as you're going to roll it, as opposed to like a basketball, which is a spherical air-filled structure with rubber. And so its form dictates that it bounces and you can throw it around. So those are some simple examples. We're going to talk about the shoulder, the hip, the knee, the ankle. These are ball and socket and hinge joints. And then we'll talk about the synovial lining and synovial fluid, which is what kind of surrounds joints and keeps all of the joint materials, I guess, inside of the joints so they don't spill out into the surrounding muscle and tendons and ligaments. We'll talk about cartilage, which is, of course, one of the most important structures inside of a joint, the underlying bone and how important that is, and then the different support structures, which are all really just connective tissue. So orthopedics is really the management of connective tissues, if you think about it deeply, in addition to the musculoskeletal system, which is comprised mostly of connective tissues. But then we also have dynamic support to the joints, which involves a significant amount of neural feedback. So your brain needs to understand where you are in space, proprioception, and it needs to have a sense of gravity and a sense of balance and a sense of reactivity to certain movements. So a lot of what your joints do, they're doing without you having any idea that it's happening, because they're all reflexive pathways that have developed between the brain and the joint to maintain your ability to stand, walk, get up from a chair, things like that. And that involves neural feedback and muscle and the muscular attachments to the tendons, which are then attached to the bones next to the joints.